667-4885. We have a lot to discuss, so we won't wait any further along. Um, let's talk about what's about to happen. Probably you will get some news about what's going to happen to your Social Security and also Medicare. Let's start with Social Security first. There's going to be everyone is going to receive an increase of 2.6 to 2.7% increase. Those of you that's receiving Social Security, those of you that's retirement benefits, survival benefits, SSI, spousal benefits, and child care benefits. So all of you are going to receive an increase about 2.6 to 2.7. Now that number may change, but we estimate that it's going to be around that amount. As I always tell you guys, whenever they give you increase in one hand, they take some of it back on the other hand. The bad news this year, remember about maybe during the pandemic, I had said that the Part B premium will go up to about over $200. We couldn't guess how much it would be during that time, but the administration at that time decided not to increase the Part B premium. So instead of increasing it, I believe at the time they decreased it, if memory served. Either they decreased it or it stayed the same. So since then, it has been increased a little bit till right now it's 185. Well, next year, starting in January, the Part B premium, the estimate is going to be about $206.50. Now, that's good news and that's bad news. And even the bad news is not so bad. And I'll explain why. If you're making under, I believe that is going to be about $1,800. If you're making under $1,800, and I'll get the correct estimate for you when the numbers comes out. But for now, for argument's sake, we're going to say about $1,800. If you're making less than $1,800 a month from Social Security, and we're not going to put your income in there if you're working. If you're working, you can forget about it. You're not going to be eligible. And I'll break it down in much detail for you so you could understand why. So if you're making less than that, and this is a great time to make sure you have my number and you keep my number and listen to me. A lot of you guys has been listening to me for a long time, and especially in Broward. We were doing a job for you, and we're going to continue to do that job for you. The same way that I've made promises to you and kept those promises, and I'm expecting the same thing from you. So the promises that I'm going to make right now is that starting next year, and don't wait till next year, when you look at your retirement check, they're taking $206 from it. And if they're taking it 3 months at a time, so you're looking at about close to 6 and change that they will be taking one time from you. So before that time, before you face that time, then what I suggest you do is call me at 954-667-4885. We are going to apply for QMB for you, or Medicare Saving Program, where it will actually pay, okay, Medicaid will pay the premium for the $206. So that's the good news. So there's reason for hope. So we will take care of that for you. You simply call me at 954-667-4885, 954-667-4885. I was talking to a gentleman yesterday on the phone, and he he said, "Well, as a businessman um, have a has a positive side and a negative side." I'm here to tell you, very simple. I'm here to help you, and every single one of you who have experience with me, I've never asked anyone a dime for the service that I render, whether it's filing for citizenship for you, whether it's replacing your food stamp card, and so on. So call me, 954-667-4885, 954-667-4885. I have to also tell you that this show is sponsored by Alto Health Clinic. It's also sponsored by Solis Health Plan. It's also sponsored by Doctor's Health Plan. So that means very simple. And please tell Tom that I'm on air. I can't answer him right now. So that's mean very simple. And we're trying to provide you with the best service possible. And what I mean the best service possible is to make sure that you have a doctor available to you 24/7. And it's very rare you could find a doctor that's when the phone call comes through, that it's either coming to me or it's coming to the doctor. And we do our due diligence to answer your phone call, and we do our due diligence to make sure that your problem is resolved, whether it's referral and so on and so forth. But we'll come back to that. Last time I was talking about Alto Health, and somebody told me that, when they listened to it, it was a commercial for Alto Health. Listen, Alto Health Clinic is here for you. But we'll talk more about Alto Health in a minute. So this coming year, you have to make sure that you're not the one that's paying the $206, that the state is paying it for you. Now, you have a choice. Your choice is to say, I'm going to let the state pay. I'm going to pay it by myself. But that would not be a smart choice if you are eligible for the state to pay it for you. And I know that everybody that's listening to me right now, I don't think there's anybody that's within the earshot of listening to me, of a radio. If you listen to me, that's when you're a very intelligent person. So if you're listening to me, you know that if an opportunity comes for you to maintain $206 in your Social Security check, you're going to do what's best for you. Many promises are made, but how many are kept? And this is one promise that I make to you, that I will keep it. And we will apply for QMB for you, or Medicare Saving Program, so the state could pay that for you, the $206. Now, probably the plan's going to come out with different plan, what they call the buyback program. And the buyback program, what it is basically, I'm going to go a little bit into that program with you. I can go into that program because I'm not a licensed agent. But that's why I always tell you straight to the point, the positive about certain plan and the negative. Now, most of the buybacks program, what they have is they said, well, I'm going to pay a portion of that $206 for you, and you're going to pay the other portion. So let's say, for argument's sake, that they'll say, well, we'll cover $185, and the difference you have to pay it. So we're talking about 20 $30 roughly, if my math is good right now. So let's say, it's for argument's sake, it's $30. So you'll be paying $30 each month coming from your Social Security. But what they don't tell you, they only put the carrot in front of you. What they don't tell you is that what's going to happen if you end up in a hospital for a period of time. Now, do you know the average stay in a hospital is about 3 to 5 days? Well, the plan tells you that if you're in the hospital for the first 5 days, and certain plan is, I believe is, I don't remember the exact number, but for argument's sake, let's say it's $250. So 250 times 5 is what? That's $1,250. JS, you're slow, you're running slow. $1,250. So, yeah, that's $1,250 that you are responsible for. They don't tell you that. Because you know why they don't tell you that? Because the person that's sitting in front of you, they are there to sell you a product. They are paid to sell you a product. But you're going to find out the real deal is when you end up in a hospital, and probably the agent is not going to be in the mood to take your call. So I'm telling you guys this so that you are aware of what's going to happen. And some of you are probably on one of those type of plan. You probably have a copay with your specialist. You probably have a copay if you're in a hospital or you go in the emergency room and they don't keep you. You probably have a copay for certain procedure like X-rays or MRI. Like I saw one plan had a copay of $200 for an MRI. These are the things that, especially this coming year, you're going to sit down with your agent. You need to discuss. 954-667-4885. That's my number. But today you could reach me right now, 305-945-1580. 305-945-1580. Call me now. I'd like to hear from you. So don't let anybody just dangle a carrot in front of your eyes and then to make you jump. Because at the end of the day, the result or the side effect of that decision, that it's going to cost you money. So what we want to do is prevent that from happening. We want to prevent that from happening. Now, and the way we prevent that from happening, listen, by the way, if you're eligible for Medicaid, in the coming shows, I will come up with, once they make it available, the new eligibility report, financial eligibility for 2026. I will have that for you guys and provide that information for you. So if you know how much it is, and then you'll know whether you're eligible to receive Medicaid. By the way, Medicaid is not a bad word. If your income doesn't meet or the income meet the requirement, then you're eligible. So that means that you're eligible to receive help. I remember many years ago, I went to this lady, and this lady is no longer with us. I went to her house to help her file for food stamp and Medicaid for her. And we had the neighbor came over and said, so and so. I could mention her name. She's no longer with us. She said, "Was about to welfare," and both people, they were in a very deplorable condition, and they needed the help. But we have a sentiment that we always try to pay this. We have a superiority complex. So we think that the fact that we're receiving help, or somebody else is receiving help, although you're at the same level, but that person is beneath you. So we want to put it out there. If you are eligible to receive Medicaid, Medicaid, food stamp, and we have a new program that we putting out. Actually, she was supposed to be with me today, and she was not able to meet up. And what we're doing for all of our patients, Alto Health Clinic, all the members of Alto Health that are eligible to receive long-term care, we're going to file the application for them. And what is going to, if you guys was listening to me on Monday, she was on the air with me talking about my Mia Ewo. She was on the line with us and answer your question. And she's going to help us with the application. So those of you who's in great difficulty of cleaning the house, of bathing yourself, and I understand even cooking, this person will be there to help you with that. 305-945-1580, 305-945-1580. And the greatest thing about it is the income eligibility. The limit of income you should have to be eligible for this program is $1,800 per month. That's the household income. And the limit of amount you could have in the bank is $2,000. So what does that mean? That means that a greater portion of our seniors will be eligible for this program. Now, the process is that, and maybe we'll discuss that with Dr. Semmelus. We have a different schedule, different type of discussion, but I'm going to try to see if we could sneak that in for a quick period of time, and then we could get more in detail about what's required for someone to be eligible. In terms of the medical side, we know in terms of the economic side, we know about the economic, what's required. But the medical side, we have to figure out what's required from the medical side. And we went over it. I definitely want Dr. Semmelus to go over it and give us a lot of info on that. 305-945-1580, 305-945-1580. That's the number to reach us. Okay? So if you have any question, I really would love to hear from you regarding that. There's so much we discussed here. We talk about you having, first of all, eligibility for QMB or Medicare Saving Program. what you need to do to be eligible, and who's going to do it for you. If you check on my phone, you'll see a new photo. What you're going to do to be eligible, and all that. So you call me now, 305-945. So we talk about eligibility. We talk about not only eligibility, and we tell you that you're going to receive an increase coming this coming month. You're going to receive an increase, not this coming month, sorry, starting in January of $206. I'm sorry, you're going to receive an increase of 2.6% or to 2.7%. Everyone that's receiving Social Security, retirement benefit, spousal benefits, survival benefits, disability benefit, child care benefits. What did I leave out? SSI benefits. So your SSI amount is going to increase by 2.6. If we do it on the math, 2.6 is probably going to increase maybe 2% of 900 gives you about about $18, $18 to $19. So it'll increase. Right now it's $9.54. So if it increases about, let's say for argument's sake, $20. So now it's going to be $9.78. So $9.78. Just think about it. $9.78. That means now it's getting closer to that $1,000, because my goal is really to see $1,000. Now the state's not going to be happy about it because the money's coming from them, but nowadays, $978 is not much. It still doesn't cut the mustard to cover your average responsibility. So we talk about that. We talk about what's going to happen when that Part B premium goes up. You're going to need help, and we're going to answer that call. So when you make that call to 954-667-4885, that call will come to us, and what we will do is very simple, is answer the call and set up an appointment and apply for benefits for you. Again, that number is 954-667-4885. If you're driving now or you're not in a position to take that number, don't worry about it. Every single week, same time, whether it's on Monday from 3 to 4 or Tuesday from 2 to 4, you will get that number. Okay? So let's talk about something else. I think ordinarily you guys tell me that you don't call because, one, maybe I've done a fantastic job of explaining those benefits to you, and you guys can't wait to apply them. Or two, you understand it and you capture it, but you're just holding back from calling. Nevertheless, when the time comes, you want to have my number, you want to sit down, and so we could take care of that for you. I want to talk about SSI. A lot of people, I sit down with them. I was sitting down earlier with a gentleman, and we talk about the fact that he's eligible for SSI. And what can we do to help him transition from what he's getting right now in terms of income from retirement and what the amount is going to be, the difference going to make when he has SSI. Let's say, for example, you're getting $500 from Social Security, and you got quite a few people that are getting that amount from Social Security. If you're getting that amount from Social Security, then you're eligible for SSI. That's part of the eligibility. Then the other eligibilities that you need to meet are the following. You need to be able to, you need to be a U.S. citizen. A U.S. citizen, what that means. A U.S. citizen, that means that a U.S. citizen, well, you know what a U.S. citizen is. You know what a U.S. citizen is. You have to be a U.S. citizen. You have to be, any change that's being made in your household, you have to be able to report it within 10 days. Secondly, you have to be able to, no, you cannot travel outside of the United States and spend more than 30 days. Now, I usually tell you 29 days. Let me tell you why I tell you 29 days. A few years ago, I think it's been a couple of years now, we went to St. Lucia, and on our way back, there was a dent at the nose of the plane, and the plane couldn't fly back. And I was standing in line to board the airline when they decided to stop the boarding. So now what happened is that call everybody back and let them know that they're going to send them back to a resort. I wish they had sent me back to the resort where I was staying, but the resort where they sent us was not a nice one. So the whole night, barely, you didn't feel comfortable sleeping. But the next day we had to wake up early to catch a new flight to come to the United States. And I never thought that would happen to me, but I had to experience it. So in this case, if you have SSI and you travel outside of the United States, that day, if I was on SSI, then what would have happened is very simple. Then I would have exceed the amount of days that's allowed for me to stay out of the United States. So you always just make sure. Now, I'm sure that you could provide an explanation of what happened, and I don't know how forgiven that they will be. But it's better that you're safe than sorry. It's better than you do than 29 days. And in 29 days, if you miss your flight or there's no flight, then you come back the next day. You're still in compliant. You still are in compliant. So therefore, that's why we ask you that to respect that limit, to respect that limitation. The other thing that's required of you is to make sure that you have no more than $2,000 in the bank. And the way that comes about is very simple. is if a friend or family member, somebody tells you that, hey, I have $2,000. I want to put it. I want you to hold it for me, so I don't spend it because I need it to do something. Then your best bet is this. It's very simple. Tell that person, no, you can't do that because the program that you are on do not want you to exceed $2,000 in the bank. So both programs, whether it's long-term care, whether it's SSI, the income limit is $2,000. And by the way, the thing about long-term care, in terms of the price, how much your home value, and I think I'm going to let Mia talk about that. I think next Monday we're going to make an effort. She'll be live with us, and we could discuss that at length. So I gave you all the requirement for SSI. It's a good program, and it is run by Social Security, but it's also a state program. It's state financed, so the money is coming from the state budget. Okay, just like disability, which I was not aware of until I was doing a research and find that out. 305-945-1580, 305-945-1580. Let me hear from you. Now, while we still have time, there's another benefits that I would like to go over with you. And the benefits I would like to go over with you is somehow is survival benefits. Survival benefits is important. And, you know, every time I talk about survival benefits, I think about the young folks because it has a greater impact on them financially. Because if you're raising a child, or if you have a child, or two, or three, and then all of a sudden one of the partners is no longer there, that income is no longer there, it's becoming twofold. Your problem is becoming twofold, whether you don't have the financial means to send your kids to school, you don't have the financial means to feed them. And now you have to do maybe 2 jobs to sustain, to provide for them. And meanwhile, what you're lacking is that the quality time that you should be spending with them during that stage of their lives. So having the survival benefits, and the way the survival benefits work is very simple. If you have a spouse that's been working and has been working for 10 years or plus, paying into the Social Security retirement fund, then once that spouse passes away, then you're entitled for survival benefits. So there's a certain percentage of that income that's coming to you, and also there's a certain percentage that's coming to the children. Now, if you're working, you're making over a certain amount, then they won't give you survival benefit. They won't give you the survival benefits, but they'll give it to the children. That's mean the portion for the children will be higher. Now, if one of the spouse are getting is getting the survival benefits, and you're able to continue to work, and my suggestion to you is that you, first of all, survival benefits, you have to go to the Social Security office, provide them with the the death certificate. Oh, the death certificate, birth certificate, and of course, on the death certificate, they'll have that person's Social Security number on there, and marriage certificate to make sure that you were legally married to that person. So I suggest that you file what we call a restricted application. And what I mean by that, a restricted application is going to allow you to work and continue to receive their benefits. So when you reach the age of, we'll say 67 now, because the folks that was born in 1960 and up are the one that's about to be receiving retirement benefits. It may be in a few years or so, but your numbers are coming. So we'll talk about 67. And once you reach retirement benefits, let's say, for example, for argument's sake, you want to retire at 65. That's early retirement. And so you want to retire at that time. But at the time, what you can do is this. You could sit down and compare what your benefit will be if you take it at the age of 65, and you could make a decision and see, according to what you're receiving in terms of survival benefits. So they give you that choice. You could opt to keep the survival benefits if it's higher, or if your benefits is higher, then you could keep your benefits. You cannot have both of them. So many times I get that question, and it's usually the same answer. 305-945-1580, 305-945-1580. So, yeah, you cannot have both of them. And if you are not eligible, if you don't have any children, and you're not eligible to receive the survival benefits, then the earliest you could receive survival benefits is at the age of 60. Then you could go back and apply for it. Now, it's not retrospected. There's no retro. Did I just lost what? Well, anyway, it's not retrospective. So, which means that you cannot go back and said, well, my spouse died 6 months ago. They're not going to go back and pay you for the 6 month. You are going to receive benefits based at the time of your application went in. So they're not going to go back and say, well, 6 months, we'll pay you for the 6 months prior. 305-945-1580, 305-945-1580. I have 8 more minutes left, so if you have any question, please call now. 305-945-1580, 305-945-1580. So, yes, it's not retro. You're not going to receive the last 6 months that you didn't apply for. They're not going to pay you for it. And normally, what I tell everyone that I sit down across, I feel an obligation to do so, because if I'm helping you, then I feel an obligation to help you along the best way that I can and provide you with all the information. And the information I'm talking about is for the kids. I suggest that you open a separate account for them, so that money goes straight into that account for them, and then that way that money continues to grow, and you don't have to borrow from it. Now there's going to be hard times, difficult times, but if the money you don't know it exists, simply just deposit money there. And I'm not saying that for the case of there's a lady I spoke with probably a few years now, and I remember what she told me is that money, that's what she used for after school care for the kids. There's another young lady that when I remember when she told me that her husband had passed. She's a sole breadwinner, and my first question to her was, "Did you go and apply for survival benefits?" And she said, "Oh yes, that's the money I used to put my kids into private school." So those are other options also. But you could also allow that money to stay there. So when they're ready to go to college, then you have the money for tuition and money for dormitory. 305-945-1580. So those are the options that you have. But open a separate account, and that way, when they're ready to go to college, you could say, well, this is money that your mom or your dad left work and left behind for you, so that today you could go to college and get a better education. Now, if in the event that you're thinking about, first of all, let me say that right now we're broadcasting live on Facebook and YouTube. Now, I want every one of you guys that's listening to me, that's not seeing me, to go on your phone, on whether it's Google or Facebook, go on Facebook and type WSRF 1580. And you're going to see a handsome gentleman. Okay, I'm glad you agree with me. And silent. I'm glad you agree with me. You're going to see a handsome gentleman. I want you to subscribe. Subscribe, and if you have your setting on a different language, let's say you have it in French, it's going to say abonné. So you click on it, and then so every time that I'm on air, I'm live, then you'll be able to receive that show in your box, in your inbox. I was talking to someone, I think I was on air on Monday, and we were discussing about the benefits of long-term care. And I truly say this, I said, I'm not saying this to boast, because the gift that I have is a God-given gift. Woo. I don't believe I'm saying this. It's a God-given gift. So if I boast, I'm boasting, I'm giving the God Almighty the glory for allowing me the opportunity to bring you information, and the type of information that really making a big difference in your life. So, and this is, I would say this is the only show in South Florida that will bring you this type of information. raw. So take opportunity of that, because I don't know how much longer I'm going to be able to do this. Every day I get up, whether it's the battle with life, whether it's age, and I'm going, how much more? How much longer can I do this? But if you listen to me and you take those information in, one thing I could guarantee you, if you come back 10 years from now and play the same show, they will be as relevant, if not more, 10 years later. It's been an honor and a pleasure to sit at this chair and do this job. I'm not going anywhere yet. But for now, I say goodbye, and we'll see you soon. Again, you could always reach me at 954-667-4885, 954-667-4885. I love you guys. Peace out.
Nouvel gaye, nouvel tombe. Nou nan yon nouvo lokal ak yon nouvo nom ki se Alto Health. Alto Health toujou pi wo. Pasan yo se VIP e yo ap toujou rete VIP. Alto Health ap traite